So could you define value for those of us that haven't gotten that far in the dictionary? Because there might be a different view of value if you're 27 and can't jump on your parents' policy than if you're, I don't know, 57.
Well, you know, so that you're bringing up two sort of separate issues. One is that the way that the reform legislation is written is you have 3 age bands, but otherwise almost no differentiation by risk. So, so clearly the actuarial value of the policy, Tom could talk about this much more authoritatively than I can, is going to look very different for those different classes. So that's part of the value issue. So one could argue that insurance premiums are not the best redistributive mechanism to deal with that. So that's one aspect. But I'm saying even if you take away that problem and you do have differentiated payment by age and so on, you still have the issue that people may not find that it delivers enough value. So for example, if you wanted to have a health insurance plan that just paid for the really necessary forms of care, and by that I mean stuff that has a very high payoff, and you decided, well, if I get cancer, I'll have first-line therapy, but no unproven second and third-line therapies. You can't buy such a policy. And in fact, I don't know if the actuaries have figured it out. There have been experiments that have been done. Blue Shield Foundation of California actually convened a group to come up with a minimal plan, and surprisingly, it looked just like a standard Blue Cross or Blue Shield plan, and it cost accordingly. But the fact is, there may be people who would want emergency care and some basic high-value services. You cannot buy such an insurance product in the U.S. as far as I know, and if any of you know of such a product, let me know.
Well, there's been a lot of innovation in healthcare products, and a lot of people have tried to do it. The problem is when you come up with a low-cost plan, someone always says, but it doesn't pay for this. We've got the high-deductible, catastrophic-only plans. We do have, they're limited benefit policies, not comprehensive major medical, but what are known as mini-meds are actually becoming quite popular among some consumers. The underlying issue really is the healthcare cost, because that's what drives the cost of the premiums. With young people, we have a particular problem because they don't view health insurance and that financial protection the same way that someone in my age group does. To make it very concrete, my son, who's 21 and about to graduate from the University of Maryland, simply is not going to place the same value on having health care coverage that I do. And that's reflected in the uninsured statistics. If the older you get, the more likely you are to be insured, because we see it as most important. One of the things that this, as it was mentioned, one of the things this legislation does is it limits the extent to which you can reflect age in individual market insurance premiums. So where Joseph's costs are going to be about a fifth of mine on average, the legislation will only allow his premium to be a third less than mine. One of the concerns is, on the margin, that's going to make more people who look like me interested in buying insurance and less people who look like my son interested in buying insurance. Now, there's subsidies and there are mandates and there are other ways to address that, but that's the kind of issue that you can easily get wrong when you're trying to restructure insurance markets.